thank you everybody for coming today. I'm going to give it to Dr. Lewis to get us started.
Thank you. And on behalf of the members of the Orleans Parish School Board and NOLA Public Schools, I thank you for joining us this afternoon. When we released the roadmap to reopening in early July, we did so with the health and well-being of our students, our teachers, our staff, and their families in mind. Our plan was developed to adapt to the changing health data trends throughout our city, providing the ability to pivot to remote learning should the need arise. The roadmap also prioritized in-person learning because we believe it is the best way to support the whole child and to help them grow. And while we still believe it's absolutely critical to return our children to the classroom, unfortunately, at this time, the data is going in the wrong direction, indicating that we can't do so just yet. Based upon our monitoring of the current critical health data, such as the increase in cases per day and other important factors, we have made the difficult decision to begin school under a distance learning model in August. This decision applies to all NOLA public schools. We are making this shift because we are listening to the advice of medical experts, and we're committed to helping New Orleans get back on track and to help keep our students and teachers healthy given the current rate of community spread. We know many teachers have concerns about returning to school as community spread increase, and we want to do our part to help reverse these trends for their sake and the sake of their families by reducing the number of people moving and gathering as best as we can. Moving forward, we will continue to monitor key indicators, including the number of cases, testing capacity, and indication of community spread to see when we can shift to in-person learning. And we're hoping to return our students to school following Labor Day, based upon a review of the data at the end of August. While students will be starting learning remotely this year, school buildings will remain open so that staff may access the building to support distance learning and offer critical services and supports to family as needed, such as school meals, while following the established health and safety protocols. Making this decision is a critical step towards limiting the spread of COVID-19 in our community and getting our students back into the classroom as soon as we can. And as we continue to listen and engage with teachers and families, we know that this decision will bring calm to some during this uncertain time and present new challenges and concerns for many others. That's why we need the help of our entire community on what happens next. We cannot do this alone. Over the coming weeks, we are relying on all New Orleanians to do their part to limit the spread of COVID-19 in our community and to ensure that we can return our kids and teachers together to school in September. Every time you leave the house, please think of the 45,000 students throughout Orleans Parish. For them, for their futures, and for the future of this great city, I am imploring you to mask up, wash your hands, socially distance when possible, and stay home when you feel sick. Returning to school, I must say, it won't be easy. But it must become our city's top priority. And I don't just mean a priority for the people at this press conference here today. I'm talking about every single member of our community. New Orleans, we are strong, we are resilient, and we are New Orleanians, and together, I truly know that we can do this. At this time, I'm going to ask our board president, Mr. Ethan Ashley, to come forward and share a few words at this time.
Thank you, Superintendent Lewis. Good afternoon. Thank you for joining us here today. I just want to reiterate that NOLA Public Schools is committed to communicating consistently to our families, our students, our educators, staff, and community during these fluid times. Today's announcement regarding the start of school was not an easy call to make, but it is the right one that we must make in this time for the health and safety of our students, our teachers, our families, staff, and community. As we've stated, this is our top priority, the health and safety of our family, students, communities, and staff. And as your board president and as a parent, I know all too well that our students and parents long for a time when we can enter back into classrooms. But as we've heard today, that is not the case right now. And while we're not safely able to enter back into classrooms right now, given our current circumstances, I do believe and I know that our educators will continue to rise to the challenge of supporting our students as they always have. For this, I want to say thank you for their commitment and flexibility as we enter into these new uncharted territory together. It's important to note that our schools are committed to continuing to offer meals to those families who need them during distance learning, and we are very grateful to our schools for stepping up to ensure that our families are fed during these times. As Superintendent Lewis has stated, we will be providing weekly updates as we approach the school year. And please continue to reach out and let us know what questions or concerns that you have as we try to ensure that we're supporting our students as best as we can for what comes next. Now, I want to end by thanking our mayor and our city health experts for their partnership, support, and their leadership during these unprecedented times. It feels good knowing that we have a mayor who stands aligned to make sure that the health and safety of our students is the #1 priority. And as board president, I just want to thank Madam Mayor for always having our back. It matters to all of our children and our staff and our educators. Now remember, the actions that we take today have direct impacts on our children's future. With that said, stay safe, mask up, and we will get through this together. At this time, I'd like to turn the mic back over to Superintendent Lewis.
Thank you again, Board President Ashley. At this time, first of all, want to also thank our mayor for being here. We're going to hear from Mayor Cantrell in a few minutes, but right now we want to allow everyone to hear from our medical experts. Of course, we're going to start this afternoon with Dr. Avegno, who, along with Mayor Cantrell, has been a great partner with us as we think of the school system, but more importantly, they have been great leaders in the city of New Orleans, and I also will say in the state of Louisiana, as we are navigating through this unknown crisis in our community. And so we're very grateful for their leadership, and at this time, we are going to hear from Dr. Jennifer Avegno.
Thank you very much, Dr. Lewis, President Ashley, Mayor, Dr. Springgate. This was obviously a very difficult decision to make for everyone, and one that we all hoped would have had a different outcome. But unfortunately, our data is not where it needs to be to allow us to safely send children and staff back to school. Since mid-June, we've watched average number of daily cases steadily increase. It's been an alarming trend that's continued even as we have tightened restrictions. Every model shows that our rate of transmission of the virus, how quickly it spreads in a community, is above the number 1, which indicates widespread community transmission. That is clear also in our positivity rate, the percentage of tests that come back positive, which has actually more than doubled since June. And while we continue to maintain a level of testing that's much higher than other communities, we do not have enough tests available to regularly test children, teachers, administrators, staff in the school setting in a way that would make us feel really comfortable. Our hospitals are holding strong, but at this point, any significant increase in cases locally or statewide has the potential to overwhelm the system. There is not a lot of precedent for these decisions. We don't have any examples of countries or other places that have successfully opened and kept open schools with this level of community spread. And while it is apparent that kids may not be as susceptible to severe illness from COVID, we do know that they can transmit the virus to those who are. At our community testing sites, we've seen many children test positive alongside all the other members of their household. While I fully support the diligent return to school planning efforts of our administrators, we have all agreed that this level of community transmission, bringing children, teachers, staff, administrators together in the classroom, could be disastrous for our schools, our families, our communities, and our healthcare system. I want to be clear that we, like most public health and pediatric experts agree, in an ideal world, the absolute best place for children to be is in the classroom. So this should be a motivator for all of us. As Dr. Lewis said, every little thing each and every one of us does in the next few weeks should be with the goal of supporting the children of New Orleans. Do everything you can to suppress the spread of the virus. Stay home as much as possible. Wear a mask at all times in public. Limit your interactions with others. Maintain distance when you are around others. Keep social gathering sizes to a minimum and within a defined bubble. Wash your hands often. Regularly disinfect your surfaces. If you feel sick, please stay home. If you've been around someone who has been sick, please stay home. These are the same principles of disease control we've been talking about since March. We need to continue to do them for our children. I do believe that we can get to a place where it will be safe to return to school. We have done it before. We successfully suppressed the virus for quite some time in this community, but it's going to take everyone's sustained cooperation. And please understand that when we get to that day, when we're able to allow our schools to reopen, we have to make that the priority, and we cannot then loosen other restrictions to the detriment of our children. This is the new normal. Until we have a vaccine or a cure, we need to stay the course. We absolutely owe it to the next generation. Thank you.
Thank you, Dr. Avegno. Last week, I mentioned to all of you that New Orleans Public Schools had hired a medical advisor who will be assisting the district and schools on health policies entering the new school year. Dr. Benjamin Springgate is with us here today and will talk a little bit about the importance of our city's actions and the impact on students' return to school. At this time, we'll hear from Dr. Springgate.
Thank you, Superintendent. Thank you for the introduction, and thanks to the New Orleans Public Schools for the opportunity to be here today. My colleague, Dr. Ryan Pasternak from LSU Pediatrics, and I are grateful for the opportunity to serve as advisors for the New Orleans Public Schools. We will advise the district and schools on how best to proceed with reentry planning and implementation of reopening. The district has put into place the necessary modifications, such as wearing a face covering and other guidance to keep our children and educators safe when on campus. When we get to the point of seeing a decline in community spread rates of this virus. That, coupled with the procurement of personal protective equipment and supplies for all schools, should serve as an additional layer of safety against the spread of COVID-19. However, as has been noted already today, the trends for new cases and community spread are continuing to go up and in the wrong direction. Therefore, we agree that it is not advisable at this time to send the children back to campuses. We have to work together, all of us, to ensure that our schools can support the health and well-being of students and staff as they reopen. This means that everyone in the community needs to do our part to prevent the continuing spread of this virus by doing simple things like wearing face coverings and practicing social distancing. Children need classrooms and playgrounds. No one denies that. We're looking forward to working closely with the district and school leaders, as well as city leaders, to ensure we're doing everything we can to keep all students and staff healthy and safe in the classroom. And all we can do at this point is ask that our community members do their part as well to ensure that we can all return to school and a bit more of our normal lives in the coming weeks ahead. Thank you.
Thank you, Dr. Springgate, as well as, again, Dr. Vegno. Again, as we are leading here in the city of New Orleans around our education system, we want to make sure that our community is aware of how we're looking at supporting our young people and our educators by tapping into the, of course, New Orleans Health Department led by Dr. Vegno, and then also bringing on a medical advisor to be able to make sure that we get the information that is needed to support our students and our families and our educators. As I mentioned before, we are very fortunate to have our Mayor LaToya Cantrell with us this afternoon. Mayor Cantrell has been a great partner. As often I say, even as we think of the initial response to COVID-19, we were all locked in step, making sure that in March, when we had so much uncertainty, and in the city of New Orleans, we, along with the city of New Orleans, met prior to our governor stating that schools will be closed across the state of Louisiana. But based on the health information and where we were at that time, that we were going to close schools here in New Orleans before that announcement was made. And we're very fortunate to have that partnership in our mayor and our leadership in our city as she continues to lead with people first. And when we talk about people at this time, as we think of August and transition to school, it's our students and our educators. And so again, the decision that we made today is one that is the right decision, and is one that we know that we have to continue to look at as we go through this uncertain time and make the right decision moving forward. But it's going to take the support of our community doing the things that we said and the things that we continue to hear our mayor say to bring these numbers down. So again, at this time, I'm going to turn the podium over to our mayor, LaToya Cantrell.
Too like volleyball. And good afternoon, and thank you so much for inviting me, Dr. Vegno, to be present with you this afternoon, as we have been present since day one, and we will not waver. Dr. Lewis, thank you. President Ashley, thank you so much. Dr. Springgate, glad to be in your presence, and I'm glad to know that you are front and center advising our public schools. So thank you. And of course, you know, Dr. Vegno. Yes, indeed. But this is probably the most difficult decision, but yet not so difficult considering the existing conditions in our city. But it will have significant, a cascading effect on our city because our children will not be able to attend school, be in those seats with direct instruction. However, we know that we will continue to do our best as we start the school year with distant learning. I said prior to the 4th of July, and I pleaded to the community that if we wanted our children to return to school in that environment that they're used to, but that they need to thrive, that it truly depended upon the actions of adults being that example. You've heard here that we know what our children need so that they can reach their fullest potential, meaning that on-site instruction and also in a healthy environment for themselves and for our instructional leaders. So we know what we need for our young people. But you know what? We have not provided what they need. A healthy environment, a safe environment, so that they can return to school this fall in those seats. So I'm asking you, everyone, to let's make our children our top priority. And when we put our kids first, and we've been saying this even pre-COVID, if we put our children first in every decision that we have to make, then we know that we're going to be a healthy community, a vibrant community, and one that has the economic foundation that we all need to stand on. So we're not there yet. But what I do know is that we have everything that we need to get there again. No doubt about it. Because the reason that the city of New Orleans was able to flatten that curve by 96%, it was all because of the public's doing. They followed the guidelines. They listened. They trusted government. But we need everyone to do that more so right now. Because remember, we entered COVID-19, we entered at a deficit. The disparities in our community, they're real. And those disparities exist as relates to the level of education and where we want our children to be, and we know that we need them to be there for a thriving city and an economy. We need to turn this around, and we can do it. But let's make sure that our children become our top priority and not following in terms of the guidelines that are put in place, not actively going against them, knowing what the outcomes will be. So this is our opportunity, but more importantly, I'm going to pull from my Mayor Sala in Milan. He says, you know what, it's our obligation. So this is our obligation to ensure that our children and our instructional leaders have what they need to be vibrant. So my commitment to the New Orleans Public Schools, NOLA Public Schools, the Orleans Parish School Board, and to all of our parents and to the community at large is for the city of New Orleans to continue to be a partner, be unwavering, and do all that we can to ensure that we do not lose our kids in the midst of distant learning. Because the environments in which they're in, some of them are not great. We need them back in that classroom for the support and the resources that our kids need to reach their fullest potential. So with that, I'm going to back up and let you, Superintendent, come on back, and then we'll take questions and answers, I'm sure, and we'll take it from there.
Thank you, Mayor Cantrell, for those strong words and your message for today, which is just a reminder to our community that it's up to us to do what's necessary so that we can get our young people back into school so that they are able to be in those buildings with their educators to receive the education that they so rightfully deserve. As we transition now to questioning, I will first of all want to continue to thank our community, our school leaders who have been working tirelessly in preparation, because again, when we released the roadmap in July, we were preparing for various scenarios. And now our leaders have the concrete scenario that we're following right now to open schools, but they've been preparing for all of the various scenarios so that we could be on top of having a very strong opening to schools. So I thank all of our educators and school leaders for the work that you have done to get us to this point as we move forward with the opening of the 2020-21 school year. At this time, I'll turn it back over to Dominique, and we'll start our question and answering period.
Thank you, Dr. Lewis. Thank you, everyone. Okay, we're going to go with media questions now. For those of you who were here last week, you remember the drill. I'll call on the outlet one by one, and you'll each get one question, and we'll come back through to you. Don't worry, it'll be equal and fair. And I'm going to start with Jennifer Crockett from WDSU. Jennifer, go ahead and unmute yourself.
Thanks, Dominique. Someone answer or clarify if teachers are going to be in classrooms or if teachers are going to be on school campuses, or if it's just the students that will not be returning to school campuses in August. Someone can clarify that point.
Yes, certainly. So again, as we begin the upcoming school year, our students will be at 100% distance learning, but our staff members at our schools will be in buildings, and they will be following the leadership of their leaders at those schools. But this announcement today is to announce the distance learning for our students, and they will be home during this period of time until as we continue to reassess the path forward.
Okay, thanks, Dr. Lewis. One point of clarification for everybody here. We also have Tiffany Delfor, our Chief Operations Officer, on virtually in case we need her to take any questions. Okay, I'm going to go to Rachel Neal with WGNO next.
Okay, I'm sorry about that, guys. Yes, I think I heard somebody saying something about Labor Day. So to make this a little bit clearer, are we expecting students could possibly return back to campus around Labor Day?
So again, we will be making an assessment at the end of August, and we'll be looking at the data in our community to determine, again, our plan and our hope is to be able to return our students back to school in the month of September after Labor Day. But again, we'll be monitoring the health data in our community.
All right, thanks, Rachel. Della with the Advocate, time to speak to you. You're up.
Hi, can you hear me?
Yes.
Thanks so much. Sorry. I have two questions and they're completely different. So should I do one at a time?
Yes, please.
Okay. What about teachers who are going to classrooms physically to teach, with technology, to students remotely, but also have children?
Yes, again, as I said earlier today, this announcement definitely is making a lot of our families, giving them some relief, but we do know that as we think of our educators who also have children, there's some decision-making points that need to be considered in how we navigate that. And many of our schools are working with our families to understand that particular need, and that is going to be up to each individual school, but that is a concern that we recognize when our employees, and not just our teachers. We have our individuals who are working as cafeteria technicians. They have families as well. And so again, all of our educators, and that's why we want to support them and the efforts that we're doing right now. But we also have to make sure that our students are able to not only receive their education with our teachers, but also we know those meals that they receive are very, very important. So again, it's the various individuals that are working in our school system that also this will impact and have to make those decisions of child care and how they work those things out.
Great, thank you. Question number two possibly is for Dr. Avegno or the health department or
Okay.
a health director. Do we have to
encourage, do you think, for students to get back into school buildings? What is the goalpost here? What are we looking at?
So there's several things that we're looking at. We had set that threshold of 50 cases a day many months ago because we felt that that was a level below which community transmission was fairly well suppressed. And we saw that for a very long time, weeks and weeks, and there's definitely a noticeable difference. So, you know, what most plans, from the White House plan to others on down, recommend is a sustained decrease of at least 14 days. And for us, that would be below the 50 threshold, but that's not the only thing that's going to be considered. It's going to be certainly the hospitalization data, the testing capacity, and the percent positive tests. So all of those together really paint a picture of whether or not we're suppressing the virus in the community.
Thank you.
Tiffany, did you want to add a little context to that? Sorry, Dr. Lewis.
I don't think so. I think Dr. Avegno clearly articulated that. One of the things I've learned about this pandemic is that we need to remain flexible and fluid and make sure that we understand the data. And so the New Orleans Health Department is the best place to do that, and we'll continue to follow their guidance.
Okay. Thanks, everybody. Next, we're going to go to Dawn with WYES.
Hi, can you hear me?
Yes.
Thank you. I am just wondering about incoming students, any new students at any new school, in terms of accessing the technology they will need to be ready for day one. How do we make sure we're not missing kids right off the bat?
Yeah, so our schools have been working with their students, and we'll continue to work with the students as we approach the upcoming school year. And as a school community, of course, we know that our school board initially did an initial allocation of 10,000 Chromebooks as well as 8,000 hotspots. And so as we prepare for the opening of school year, our school leaders have done an excellent job at making the purchases so that as we begin the upcoming school year, we're beginning the school year with a one-to-one for this school year, and which is a great accomplishment for our city, that we'll have a one-to-one ratio with computers moving forward.
Okay, thanks. We're going to go with Natasha Robin with Fox 8 next.
Hi there. So I had a very similar question, but I'll ask it this way. For the distance learning, will the particular schools be in contact with the parents to really discuss exactly how everything is going to work in the coming weeks? And will that begin when school was supposed to start in August?
So absolutely. Our schools, just like any school year, at the very beginning of school, our schools have orientation and various means to make sure that families are acclimated and prepared for the upcoming school year. And this year is very different, but it also is like no other, where our schools are still doing the same thing that they would normally do. However, this year, we're adding components of distance learning, what it's going to look like, what's going to be expectation for the student, what's going to be expectation for the parent, and so on. And so our schools have been communicating with our families. They also will be communicating some more information out this week based on this announcement. And so we're going to ask our families, our parents, to continue to work with your school so you can get that information specifically for the school that your child will be attending next month.
Thank you.
All right, thanks, Natasha. Next, we're going to go with Jade with WWL. Jade?
Hi, good afternoon. Thank you so much. I apologize. My connection kind of cut out, so I apologize if Avegno had already answered this question. But you mentioned the testing capacity. I'm just curious what that current capacity is right now, and what would be needed for the schools to reopen. Again, I apologize if you already answered this.
No, I didn't. Our testing capacity is holding steady. It is not as robust as we would like it. And, you know, to be clear, there is no national testing protocol for schools. There is no CDC guidance on this. There's a group of us with Duke and the Rockefeller Foundation that are actually working on developing protocols. What would it look like to have robust testing for schools? What makes most sense? But there's really no guidance there. What we know sort of instinctively is that if we could offer increased testing to returning staff, whether that's high-risk staff or certain other groups that we want to prioritize to make sure that they know what they're going into when school reopens, that's something we would want to do. We do not have the capacity right now. We're engaging the local health systems to try to think of creative ways. Dr. Springgate has been involved in that. So if we can think of a creative way to do testing, then we will. That doesn't, that doesn't change how we act. If we want to go back to school, whether we're a parent or a teacher or a kid, we should be doing all the things right and almost quarantining ourselves before we, go back after that Labor Day start if the data is favorable. If testing can be increased to support that, then we would love to do it, but our actions remain the same.
Thank you.
Okay, next we're gonna go to Aubrey with WWNO Radio.
Hi, thanks so much. My question has to do with a lot of both parent and teacher groups, were calling for in-person learning to be postponed, but they were also calling to use that postponed period as an opportunity to engage with stakeholders some more, whether it's a matter of having town halls or reworking, going back to the task force, a new survey. I was curious if you guys have been thinking about those concerns and how you plan to include stakeholders between now and making the reassessment at the end of August.
Yes, again, even as we shared that we're going to be doing not only weekly updates, but also as we prepare for the upcoming school year and our families are now engaging more directly with their schools, that's also one of the best places that we can get information of where the concerns are, what the needs are. And so again, as I think of the 45,000 students we have here across the city of New Orleans and the schools that they will be attending, I will again encourage our families, our educators, that you work with your school community, and as well as the school district, we're going to be continuing the work that we have with the advisory task force and those things there, and we'll be also announcing some other initiatives that we'll be doing to continue to hear the voice of our community. But again, I want to stress the point of, as we prepare for the upcoming school year, for our families to make that direct contact with the school where your child will be attending, and for the school directly to hear those concerns and needs that you may have, because our schools are here, our leaders are here, our educators are there to support you during this very, very tough time.
Thank you.
Thanks, Aubrey. Thanks, Dr. Lewis. Dr. Lewis, I'm just going to tee up really quick Tiffany to answer the previous question ahead of this. It's just from testing in schools as well. Tiffany?
Yeah, Dominique, if I can come back to that in a little bit, I'm having a little trouble with my video.
Okay, that's fine. We'll come back. No worries. Sarah with the Gambit, you're up.
Hey, I'm wondering why teachers have to go into schools, and will they have the option to teach from home if they don't feel comfortable going into buildings?
Yeah, so once again, as we think of our community and where we are, we made the decision to limit the number of people in buildings, again, by having our students to stay home and start the distance learning model. So it becomes a place where our educators are able to report. If there is an educator that has a health condition or concern, they, as we shared before, need to continue to work with their individual school organization to share those concerns. But the expectation is, as we move forward with distance learning, that the employees of our schools across the city of New Orleans, that they will be in the school building providing those distance learning services, as well as other services that we need to provide to support our students and their well-being. And one that I continue and will continue to mention is also, if you think about it, when March through May, our food service technicians, they were there every single day on the front line. And our educators are also on the front line because we are working together to educate young people. And so even speaking of our technicians, they serve by the month of May 1 million meals. So we know the importance that even though we may be doing distance learning, the importance for even our cafeteria technicians to show up so that we can make sure that these most nutritious meals that many of our students receive, is the only meal that they receive many times, that we're still able to do that in a distance learning way as well.
Thank you. And Dr. Lewis, I would also add that we want the school buildings to be able to be used as resources by our teachers, especially with distance learning. We have robust technology in our school buildings and in our classrooms, and we want teachers to be able to take full advantage of all those amenities in our buildings. Again, this will be a school-by-school decision based on when and how staff return. And if staff have concerns about returning to the building, they should have that conversation with their school leaders, as we know that that is a concern many people have. But we want to make sure that our buildings are useful tools and made available because of the technology available and all the other ways that we use to support our schools, like Dr. Lewis mentioned, with child nutrition programs. So school buildings are open for use, and we hope to utilize them as much as possible.
Okay, thanks, Tiffany. All right, everybody, bear with us. We've got 2 more outlets to go, and then we'll circle back around with everybody. But Myrna with the lens, you're up.
Hi, thanks. Speaking of using school buildings for use and being, useful to the community, I know one community that has a big concern about distance learning are low incidence students with disabilities. Could a student with that type of disability be going into a building to receive services? Is that a possibility in this situation?
So as we have students that have related services that need to be addressed, and as Tiffany just mentioned, that's another reason why we're making sure that bills are made available. And so our schools will be working with their individual student population and the students that need additional services based on their needs. We will be providing and supporting them during this time. And so again, that's another important reason why it's so important that as we're doing distance learning, that our buildings are not closed.
Okay, great. Tiffany, did you have anything to add there?
Yeah, just one special note. We'll also be updating our roadmap to reopening about some of the special operational provisions during this virtual learning period in August. And as Dr. Lewis mentioned, we know that we have students who have specialized needs and that they usually receive some kind of therapy from a provider at our school buildings. And we do want to continue to allow that at the school's choosing, but we've provided and will continue to provide robust set of safety concerns and safety metrics and standards for schools to utilize if they provide one-on-one special services to students during this period of distance.
Thanks, Tiffany. Okay, Dominic, we will assess. Dave, you're up.
Thank you, Dominic. My question is for the mayor. Mayor Cantrell, you talked generally about how this difficult decision will have cascading impacts across the community. Could you tell us more about what those impacts you believe will be, and based on the data that don't support allowing children in classrooms at this time, are you considering any additional restrictions on the community to try and get us to a place where it will be safe and healthy for children to return to school?
Well, we assess our data and where we are weekly. There could possibly be some other restrictions coming this week, but we're assessing them from week to week, so we're in that process right now. As it relates to me saying that this decision has cascading effects, it really speaks to one of the questions that was asked around employees, right? City employees as well, meaning that it's a very big challenge for our business community, for our city government in terms of operations, of course, our school leaders who are parents as well, for our children who really do need, and some of them really do need to be in a seat in front of a teacher in that classroom. I can't overstate that enough. And so those are some of the examples when I say a cascading effect. This will be one of those in the various different areas and levels. And quite frankly, the impact that it will have on our children. And remember, I said that we entered into this pandemic at a deficit as it relates to the disparity gaps that exist in our city. And the psychological and the mental impact that this also has on all of our people, again, especially our children. So that's what I meant, or what I mean when I talk about the cascading effects that this will have on our city overall. Thank you.
Thank you, Mayor. Thank you, Dave. Okay, guys, we're gonna pick up the pace here a little bit. I do want to give everybody else one more shot, so just be quick, and if you don't have a question, feel free to pass. Jennifer, however, with WDSU, I'm gonna kick it back to you.
Thanks, Dominique. I do have a question. Dr. Lewis, have you heard anything about any charter school employees, like teachers, taking they fear for their jobs? They're worried that one teacher will be able to 3 or 4 classes virtually, and they fear that their jobs will be on the line. If you have heard those concerns, or really even if you hadn't, could you address what the school system would do to try and address that?
Yes, so first of all, our schools are, of course, their own organizations, and they have their HR procedures. However, if there is a fear or concern that something has been done inappropriate, then at NOLA Public Schools, we will look into that, and if there is appropriate action to do with the charter organization, then we'll do so. But I guess what I really want to say in this moment is that as our educators have concerns about the upcoming school year, and we all have concerns, we all have families, we all are going through a very, very difficult time, but I will continue to remind everyone, as you are returning back to work and you have those concerns, the best thing and the first thing you need to do if you have those concerns, and I know our school leaders are working with their staff, but you also need to reach out to your organization and be able to express those concerns, even if you had your initial meeting and you have additional concerns. And I just encourage individuals to do that, because our school leaders are here to work with all of our family members, because we all are going through the same thing at this time.
Thank you, Dr. Lewis. Rachel, WGNO, did you have another one? I'm going to take that as a no. Okay. Dawn, WYS, did you have?
I do have another one. I'm just curious how much autonomy the individual school leaders really do have in terms of how they structure this distance learning, and whether there's any guarantee that kids are getting some equality across the board in the level of education they're receiving.
Yes, so our schools, when they come down to distance learning, it's just like if you just step back for a moment and think of our school system before even COVID-19 came on the scene. Our schools are able to approach their curriculum as they see fit for the student population that they serve, which is a unique piece of our school system. But as a school system, we will be also making sure that we understand not only the attendance of our students, but the engagement of our students at our various schools, and be able to work with our school leaders where there are deficiencies. So again, as we think about autonomy, we know that as we go through this trying time, we are transitioning to something new for many of our educators, and so our schools have given that support, and will continue to provide that support, but also as a school system, we will have our mechanism of our oversight that we normally have. But again, when it comes down to the curriculum, our individual schools are also determine what platforms they're going to be using, and that is part of what they're, the flexibility that they're able to have.
Can I ask just a quick follow-up?
Yes.
Then will taking attendance be required?
Yes, our state superintendent has made it very, very clear at this time that there have been no waivers that have been in place, so the required instructional minutes for a school year is in place at this time. So yes, we will be taking attendance of our students as we open the upcoming school year.
Okay, thanks, John. Thanks, Dr. Lewis. Della, I think you had a question for Dr. Vegno, is that correct?
I did, thanks. You know, there's some families with children in various school systems. Is there any indication right now about what we can expect for private or Catholic schools? Are they also being advised to have a remote start?
So that's a personal question because I have children in all three school systems. So this affects me personally as well as professionally. Each of the school systems have different challenges. For example, the Catholic school system is not only Orleans, it spans 8 parishes. The private school system have their own organization. We at the city and at the health department have been in very close contact with them. They have all of the same data and metrics that NOLA Public Schools have. You know, there are definitely some arguments to be made for consistency in terms of starting the school year all together, and for really interpreting and using that data and using where we are right now all in the same way. I know that they are in the process this week of discernment and really talking to their leaders, making their individual decisions. Dr. Lewis, I know you've been in touch with them as well. That, you know, and that's the promising thing, is there's a lot of sharing of information. There's a lot of desire to want to work together for the future or for the children of all of our schools. But I don't think they have quite yet come to a decision on how they're going to proceed.
I guess I have a technical question. So the health department, for instance, is not ordering Catholic schools anymore to ordering private schools.
No, we don't have that authority. I don't believe that falls under our authority.
Okay, thank you.
Thanks, Stella. Okay, Dave with WWL, final question?
I think we've covered it.
All right.
Wait, I'm sorry. Did you call on me?
I did, but Dave and Jake sound the same, and one's ready and one's confused. But Dave, you can go now.
I'm like, wait, I have one more question. Okay, yes. Because of the announcement made today, is there any thought of extending the school year to make up for this remote learning?
So again, our roadmap and what we continue to share is that we're in a very fluid situation. And so right now, we are preparing for the start of the school year. And I would say as we go through the school year, and we don't know if we have to have potential closures or what have you. So right now, that is, there's not a definite answer on that, but I just have to be very, very clear that this is a very, very fluid situation, and we will be understanding more as we go through, and will adjust when necessary.
Okay, thanks, Dr. Lewis. We have time for 3 more questions, guys, so I'm going to get to the last 3. Aubrey with WWNO. Do you have a final question?
I do. For teachers who are going into the building, are they going to be expected to follow the health and safety standards that were laid out in the reopening plan for when schools are going to be open entirely? Are they going to be wearing a mask constantly if they might be in a classroom by themselves? I guess I'm curious if there's going to be new guidance coming out based off of, you know, the smaller amount of people that are going to be in the building and the fact that it's all adults and not children.
Even though we mentioned we're going to have some supplementary guidance that will be shared later this week for our schools, many of our schools are actually in professional development right now and are abiding by those health standards that we have in place. And so again, as we begin the school year, those expectations still remain in place. But we're doing it right now as teachers are actually in school buildings right now doing professional development for the upcoming school year. Tiffany, I'm not sure if there's any additional information you would like to add.
Yeah, I think Dr. Lewis, thank you. And so as we talk about how we're beginning the school year virtually, there's a different set of standards for our teachers if they're in classrooms, because the situation, like we said, would be very different. Part of that supplemental guidance that we hope to provide schools by the end of this week about how they should proceed their building operations in a virtual environment, we will look more like office buildings or the business sector guidance that you're seeing in the city of New Orleans during phase 2. If the teacher is alone in their classroom, using that classroom and the technology available to them for distance learning, they would not be required to wear a face mask. Again, because they're likely recording a lesson for distance learning. So we will have to change a little bit of our guidance because we will not have the number of people that was assumed in these buildings. But again, what staff practices in classrooms look like is more like office building guidance for our business center.
Great, thank you so much.
Thanks, guys. Okay, Marta, last question.
Alrighty, as we talked about charter school autonomy, we know schools have the ability to make their own decisions. Could a charter school just go ahead and decide to open anyway and allow plenty of students in the building?
So at this time, for all NOLA public schools, we are 100% distance learning until we reevaluate and make a different decision.
Thanks, Dr. Lewis. And final question goes to Sarah with the gambit.
Hey, are schools going to be thinking about adjusting policies in terms of paid time off for staff and faculty if they get infected?
Yes, so all of our schools through the HR policies and procedures that are in place will be working with our schools, our educators and those employees that are working at the various schools on all of the options that are available to them as we navigate this unknown virus in our community.
Okay, Dr. Lewis, is there anything you want to wrap up with before we let everybody go?
Just want to, first of all, thank once again Mayor Cantrell for your support and your leadership during this very, very tough time. And like I said earlier, in your right hand, Dr. Avegno, you know, the two of you have been and continue to be a trusted source of information in our city from the very beginning as we have been navigating these uncertain times. And then also to Dr. Springgate, thank you so much for coming on board and providing the support not only to the district but also our schools during a time of need. And of course, our board president who represents the entire school board and our commitment to our community, our families, and our educators across the city of New Orleans, that these are very, very challenging times, very, very tough times that even the elders that I talk to have never seen anything like this. And so it's very, very different, but what I can say is, as a city and as a community, we've been through tough times before. And every time that we've been through a very, very tough and challenging time, we banded together and supported one another to get through that crisis. And that's what's necessary as we respond to COVID-19 in preparation for the upcoming school year. But in closing, you have to wear your face mask, you have to practice social distancing, you have to wash your hands as often as you can. Like, these things truly, truly matter if we're going to truly be able to get our young people back in school buildings with their educators. It's a very, very trying time, but I will say we will get through this together. Thank you all so much, and this concludes our press conference for today.